Good morning, everyone. We are about to start the board meeting. We'll give everyone a chance to get seated. Yes, great idea. Good morning. If we could start with our pledge of allegiance that will be led by Chief Milligan.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And if we could all do a moment of silent meditation for the Honorable Bob Dillinger, please, and thank you. Thank you very much. We will first start off with our acknowledgements, and that will be done by Ms. Linda Leedy.
Good morning. The Juvenile Welfare Board believes those who work to give children a brighter future deserve recognition. Today, we are honoring our newest Kids First awardee, an outstanding social service professional who consistently goes above and beyond to put others first. Her name is Thomasina Oliver Jackson. Before I share why Thomasina is so deserving, I need to let you know that she's not in our audience today because she did have an important appointment that she just was not able to reschedule. But in her place, we have Natasha Vidakovic, her immediate supervisor.
Yes, good morning, everyone. Thomasina is very honored for this award, and unfortunately she couldn't be here.
Thomasina Oliver Jackson is a PEMS Access Navigator with FSI Connect, which means she is the first point of contact for families seeking services from JWB's Family Services Initiative. As you may recall, FSI Connect is the replacement for the former 211 as the front door of our FSI program. Her nominator, Courtney Covington, describes Thomasina as an experienced intensive case manager who possesses a tremendous work ethic, demonstrates compassionate understanding for those in need, and always seeks a strength-based solution. Promptness, reliability, and just-in-time support is important to struggling families, especially those in crisis. Thomasina is known to answer calls on the first ring and eager to help support and stabilize families. Confidence, calm, and creativity are also critical skills to have, and Thomasina masters them all. In her role, Thomasina is adept at quickly achieving rapport with families and helping them feel at ease, valued, and heard. This is her true gift. The complexity of some of the FSI cases that they see can be overwhelming for most. But Thomasina draws from her decades of experience, quickly identifying viable resources and solutions for each case. Her superpower is her ability to find strength-based solutions for families and to never give up or take no for an answer. Instead, her mantra is, how do we get to yes? Thomasina is a cornerstone within the local social services community. She's a pillar with decades of experience and has demonstrated compassion in every position she has held throughout her career. She has served youth with severe mental health issues, always treating them with respect, empathy, and hope for a better tomorrow. Thomasina has a servant's heart and makes the world a more positive place. She's fully present with those she encounters throughout the day, remembering tiny details and radiating relentless joy and hope. Please join us in congratulating our remarkable Kids First awardee as we ask her supervisor, Natasha, to pass along our appreciation for her tireless work to always put children first. And we look forward to properly celebrating her at our Kids First Awards luncheon on April 26th.
Next, we have consent items. If I could get a motion for approval of the consent items, we will be excluding the Finance Committee meeting minutes due to a lack of quorum. So we didn't have the meeting this morning, but if I could get a motion.
So move.
All in favor?
Aye.
Any opposed? Thank you very much. Next, we'll go on to our action items. And the first thing is to accept the FY23 audited financials. That will be done by Cherry Becker. That will be Ms. Houghton. and Lynn Delatorre.
Good morning, Lynn Delatorre, Senior Manager of Accounting. I'm here this morning to request approval of the fiscal year 23 Annual Comprehensive Financial Report, known as our fiscal year 23 ACFR. This morning, we have Lauren Strope with our audit firm, Cherry Beckert, to do a presentation on our audit.
And just a note that while we didn't accept the Finance Committee minutes, because they didn't have a quorum this morning to approve them first, the Finance Committee did receive this report expanded at its last Finance Committee meeting.
I'll concur with that. We extensively went through the audit presentation you'll go through here now and some other issues, and we found it to be very well done. Thank you.
Well, thank you all so much. It's a pleasure to be here with you today. I'm going to take you through a very brief presentation, so it'll be abbreviated from the in-depth one that we did with the audit committee, just to really go over the highlights, the nature, the timing, and the extent of the audit procedures performed. Oh, here we go. So we have completed our audit, and we are ready to render our opinion, and that will be dated today after your approval. That is on your September 30th, 2023 ACFR, or annual, Annual Comprehensive Financial Report, or ACFR. And that is what you send to the GFOA to receive your Certificate of Excellence. So you receive that for your 2022 ACFR, and I do believe that that was the 5th year in a row that you received that. So we were ready to render our opinion, and our plan is to issue an unmodified opinion on your financial statements. That's the highest level of assurance that we as your external auditor can provide. It's a clean opinion. It's the only type of opinion you want. We are issuing a no comment letter under government auditing standards. Those standards require that we kind of take a deep dive into your internal controls over financial reporting. And if we were to become aware of a significant deficiency or material weakness in those internal controls, that would be a comment that's reported on that letter. So a no comment letter is great. And you also are receiving an unmodified opinion on your compliance with investment policies here in the state of Florida. So in summary, for all the reports that we are issuing, they are clean, and that's the best type of audit that you can receive. Just some of the qualitative aspects of accounting practices. Just wanted to mention that if you were to pick up this year's ACFR and last year's ACFR, there is a difference there, and that relates to subscription-based IT arrangements. So that is a new GASB standard that was required to be implemented in this year. And you can read all about that in footnote 1 to the financial statements, but basically you just brought in an asset and a corresponding liability for those assets. Just some upcoming reporting financial changes. You have GASB 99 Omnibus, GASB 102 certain risk disclosures, GASB 101 that really covers error changes, and GASB 101 over compensated absences. For you all, I believe it's just GASB 102 and GASB 101 that we'll have to be concerned with next year, but we'll definitely work with management to ensure we're ready to hit the ground running for next year's audit. Professional standards do require that we talk to you about any corrected or uncorrected misstatements. So a corrected misstatement is when we, as the auditor, have to say, hey, this is what needs to be done to bring the financials in accordance with GAAP. We are pleased to report that we did not have any corrected misstatements. There was one uncorrected misstatement, which is the exact same situation, only the entry is not made in the current year. And this related to a payment on a SEBITA liability, but instead of relieving that liability, it was recorded as a prepaid asset. So essentially your assets and your liabilities are overstated by the same amount. But as you can see, as far as interest expense, it was a very small amount that it would have impacted your income statement. So that was passed on this year, but will be corrected in the upcoming years. And with that, I'm pleased to take any and all questions that you might have, as long as I don't have to say ACFR again, because apparently I can't do that today.
No questions? Okay,
Thank you so much.
thank you.
So now we do have in front of you the action to approve this audited report. If someone will
Make a
I
motion.
motion to approve.
Do you have a second? All in favor?
Aye.
Any opposed? Hearing none, we can move on. Next, we'll have the approval of the community council appointment by Ms. Yurides Garcia.
Good morning. Yarides Garcia, Community Engagement Manager. It is my pleasure today and an honor to introduce a new member of the Mid-County Community Council, Katerina Tassara. Ms. Tassara is bringing over 27 years of experience to the Mid-County Community Council. I'm going to try to be as fast as I can because she has a very impressive bio. Her professional experience is supported by a bachelor's degree in psychology from the University of Southern California, an executive certificate in nonprofit management from the University of Notre Dame, Mendoza College of Business, and the completion of organizational management coursework at Antioch University through the master's degree organizational management program. Ms. Tassara has served in numerous leadership roles, including a county appointment as a Children's Commissioner in Washington State, a board member of both the California and Washington State Child Care Resource and Referral Networks, as well as a co-chair of the Early Learning Coalition. She's a lifetime member of the National Association for the Education of Young Children and is a certified trauma-informed trainer. And she's an advocate for the continued understanding of how adverse childhood experiences play a role in the human development. Ms. Tassara currently works part-time for the Lelma Nation Neighborhood Family Center as the Family Communications and Development Coordinator. She's also a consultant and a founder of Social Impact Solutions Group, where she provides grant writing services, board strategic planning, and nonprofit startup services to Tampa Bay nonprofits serving children and families. In summary, Katerina's life has been dedicated to advancing efforts that benefit children and families and to increase nonprofit effectiveness and impact in the community. On a personal note, Ms. Tassara is originally from Chile, but she has lived in Florida for over 11 years. She's the mother of a senior student who will be graduating from USF in May and who will be attending Stetson University College of Law. As an immigrant, a proud mother, and a child advocate, she's super proud and excited to join the Mid-County Community Council. Upon approval of the board members, we will have 37 active community councils representing North, Mid, and South, and Ms. Tassara is here with us in case that you have any questions.
Wave to the crowd. Any questions? Any questions for Ms. Tassara before I ask for a motion? Do I have a motion?
So move.
Second?
Second.
All in favor?
Aye.
Any opposed? Congratulations and welcome.
Thank you for joining.
Next, we will have the update on the Children's Mental Health Initiative and approval of budget amendment for North Pinellas Children's Medical Center, and that will be done by Ms. Becky Albert.
Good morning, Becky Albert, Senior Manager for JWB, and I'm honored to be presenting with Dr. Charlene Weber, who will join me at the podium in a little bit. But before we get to the highlights from fiscal year 23, I want to take us back down memory lane a little bit because we do have some newer board members, and I want to make sure we're all on the same page. Thank you. Okay, so how the Children's Mental Health Initiative started, back in 2018, we convened a group of leaders, primarily CEOs, COOs, people in the industry, and also other industries to say, what do we need to do for children in Pinellas County? With that, you can see the vision is somewhat long, but when you get a group of 50 people to decide on common language, that can take some time. So overall, really our focus is increasing access to services. We want to have a skilled workforce, and we want to hear from the children, the youth, and the families themselves and put them at the center of the care. So with that, we created design teams, and I'm going to focus more on the first three that you see on the slide: public awareness, family engagement, workforce, and care coordination across the continuum. You're going to start to see some of the outcomes today with the data that we have, which is some of it hot off the press and super exciting. And then system finance, which is going to happen, I believe, a little bit later when we go back to some of the managed care companies, just give them the data and show them the prevention effort and the work being done by our partners here in Pinellas County. So public awareness, family engagement is really increasing awareness of services. So where do I even start? As a parent, often they don't know where to go for help, and you have placed at your table, there are 2 what we call resource guides or journals. And why you have 2 is because we're targeting different areas in our community. So while the first set of, if you open up, yes, the black cover, so that comes in 2 different versions. You'll notice that the bottom resources are different because the Well for Life, for example, and New Vision Behavioral Health serve more Mid and South County, whereas the other version has the Pinellas Wellness Connection, which is really overall Pinellas County. But with that being said, there's other resources available. One in particular that I like to share is psychologytoday.com, because you can go on there by location, where you live, problem area, insurance type, etc., and narrow it down to clinicians, psychologists in your area to get what you need. So that's really been impactful, because people have been asking us, where do I even start? There's been a lack of awareness, and so this is helping to bridge the gap. We're continuing to develop and strengthen new partnerships. We've also held several events, and the reason why we're able to hold so many events is because we're leveraging resources with both JWB funded and non-funded organizations, and that's how we can reach more people. So if you've seen this slide before, there weren't so many logos on it, and there still are some that we need to add, but we continue to grow, I feel like, every day. So this is a good thing, because that means our reach is broadening. Our workforce. So why we have a design team focused on workforce, this is important because it's both clinical and non-clinical. And so when people think of the Children's Mental Health Initiative, I think oftentimes they think it's specific to clinical services, but we're also wanting to incorporate professional development and trainings needed for staff who are regularly interacting with our children and who are not clinical. So some of the issues initially identified were high turnover rate, which obviously led to vacancies. And if you have vacancies, then you can't deliver the services that are needed in our community. So that has been addressed somewhat with the workforce stabilization, thanks to JWB leadership and board approval, to really bring professionals up to the market rate, but also provide additional professional development. Maybe there's something that they didn't have previously that said would really help them move their services forward. So all of this to say that the Children's Mental Health Initiative is doing more than just that. We're working to connect the dots and ensure that multidisciplinary partners, including internal staff at JWB, have an understanding of the bigger picture and what we're trying to accomplish. So care coordination, I'm going to sound like a broken record, but I can't say enough about care coordination because it truly is important. And while we started addressing this with integrating services into pediatric practices, most recently we did expand our design team to include members from the 0 to 3 think tank. Why is that important? Well, because turbo babies, which you all are familiar with, and this age range, they're administering universal screenings. Some of it is required through the Early Learning Coalition. Some of the screenings are happening at pediatric practices. So really, we need to be coordinating the results of the screenings, because that's great that you're doing a screening, you know, at an early learning center, but then what are you doing with the results? And how are we wrapping around the family to better support them so we're not placing the burden on the family that so often happens? We're also partnering with other funders, so Pinellas County government, the Human Services Department of Health, the Sheriff's Office. We've come together and agreed to have some common language in our agreements with our behavioral health providers so that we can get a better understanding of what is the access to care in Pinellas County. How long does it really take for somebody to get seen by a therapist? I think there's also some differences with the language that's used. So access to care for maybe a behavioral health provider is getting them in the door and starting that intake process. But access to care for the family in need is actually starting the therapeutic process or the intervention or whatever the need actually is. So looking at how long is it really taking, because I think there's what we hear, it's just we need to better understand it. And the care being coordinated, again, that's my theme this year, and it will probably be the same next year. So when we integrated services into pediatric practices, we started with Evra Health, and we integrated behavioral health, so licensed clinicians, as well as patient care coordinators, wellness coaches, supports within the practice to help the family follow up, get real-time access, etc. But what we also did is we brought the REACH Institute, which is an organization consisting of psychiatrists, psychologists, and pediatricians who are experts in the field, who did a training so that our local pediatricians could become better equipped at identifying, diagnosing, and treating the low to moderate mental health conditions. And when we talk about low to moderate mental health conditions, we're really talking about anxiety, depression. ADHD is also within that. However, the pediatricians were, and you'll see the data in a moment, but they were prescribing and treating ADHD. However, I will say, with the training from the REACH Institute, there are times where it may appear that it's ADHD, only to later discover that it's anxiety. So pediatricians are now better equipped with the skills based on the intensive in-person training followed by a year of case consultation. And we're looking to bring the REACH Institute back because we have more pediatricians to train. And we're seeing the benefits of what it's done. So after we integrated the first 5 locations with Evra Health, can you go back 1 second, please? Sorry. We added North Pinellas Children's Medical Center. And this is near and dear to my heart because if you'll notice the initial spread of locations, there was a big gap, and the red star, the map on the right, is where North Pinellas Children's Medical Center sits. And it is one of the largest pediatricians' offices in Pinellas County. So between Evra Health, and by the way, between fiscal year 20 and 22, Evra Health did add another location for pediatric services. So combined, now we have 7 locations throughout Pinellas County, and the goal will be to continue to grow. Connecting the dots, coordinating care. We're reaching way beyond the, the pediatric practices. We worked with the out of school time conference folks, and they wanted to be better equipped with skills to respond to the kids that they're seeing in their out-of-school time programs, because that's just not something that they haven't had the training. And so our partners at EverHealth developed and rolled out the de-escalation training and also the trauma-informed training. And soon after the out-of-school time conference, I don't know how many organizations reached out to have our staff educator train, but EverHealth's been doing a lot of community trainings with professionals that JWB funds, primarily in the out-of-school time space. So we're showing up in different spaces and continuing to connect the dots. Same as Turbo Baby, so getting further upstream, because in order for us to truly get a handle on minimizing the crises that are happening, the Baker Acts in our community, the children who are dying by suicide, we have to get further upstream. Next slide, please. Thank you. Okay, so now I'm going to talk specifically about fiscal year 23, so our last year, and this is based on the integration of services within EverHealth and North Pinellas Children's Medical Center. So in 23, we spent $2.1 million, and we served 14,506 children. Now, what I mean by served is, it's the big umbrella, okay? It's the number of kids who were screened. So screening is important, again, for early detection and intervention, and oftentimes that is what helps the child, the family, to intervene earlier, so they're not waiting or being diagnosed later down the road. And this is just, I mean, you also have a sheet, our one-page impact sheet in your packet. Again, this is just a breakdown that 14,506 children were screened between the two partners. North Pinellas screened a little more than 3,000 and a little more than 11,000 at EverHealth. Thank you. So this data speaks to the work that the pediatricians are doing, the work that the licensed clinicians are doing, and that psychiatric visits. Now the difference here, well, there are many differences, but EverHealth has psychiatrists also integrated within their practices, so they are able to have real-time access to the visits. The therapists, keep in mind that EverHealth had 7 therapists, because again, they have 7 locations that they're serving pediatric patients from, whereas North Pinellas, when we started this, they have 1 licensed clinician. So you can see the difference. So I don't want to necessarily suggest that this is an apples to apples comparison, because there are, I would say, significant differences, including the infrastructure between the two entities. Next slide, please. So this data is specific to EverHealth, and I should have put the tables differently. The one on your right is really showing the total number of behavioral health appointments that were scheduled by patients, and you'll notice that there's been an increase in 21 and 22, and then it started to level off. That could be for various reasons. We're going to know more after we get this year's data, which will put EverHealth at a 5-year point, and we've been working with the data and drilling down more each year. And so I think we're going to start to see the scheduled appointments level off. But what you should notice is the engagement rate has primarily stayed the same between 22 and 23, which is important because if you have people showing up for their visits, that means that you're doing something right. The national standard for time it takes to an appointment
is 10 days. And so you can see that we've worked overtime to meet those needs and actually are now exceeding it with 9 days on average at EverHealth to see a behavioral health therapist. But also, we have access to therapists in real time, and you can see the orange bar is the number of unique patients. The blue bar is the number of visits. So for fiscal year 23, you can see that 770 children had same-day behavioral health visit with a licensed clinician, and some of those kids were having same-day more than once, given the 912 visits. Okay, so I am going to ask Dr. Weber to come up because this data was really brought forward to us by Dr. Weber. It's something that she's been tracking actually manually until recently, and now we have our program administrator. So things are really moving now and growing, which I knew they would because we are now in the middle of, well, almost finishing year 3. So again, this is our first agreement with a private practice, and so we're all learning how each other work. We're integrating more staff slowly, but there's a lot of growing pains, and you can't just go in there and flip a switch and think that it's, you know, things are going to happen fast. And so I say all that because we've been very intentional about making this right. And again, this data just speaks for itself. So the blue bars you'll see are diagnosis codes for ADHD. If you look at the 2017, 2018, 2018, 2019, what we did is we grouped those together for an average of how many diagnoses were happening in the first 2 years prior to pediatricians being treated, being trained by the Reach Institute. Then remember that COVID also happened in March of 2020. So that led to some tweaks along the way with the case consultation calls. So then when we're getting the percent change, we're comparing it to fiscal year 21, 22, 22, 23, okay? So you can see that the impact, the change with anxiety and depression from before they were trained to after they were trained, and now they're really moving along, right? This is North Pinellas in particular, 901% change. So that means they're keeping these children in their medical home. They're not having to necessarily refer them out to psychiatry like they were previously. This is addressing the issue that was initially identified with access to care. Now I'll turn it over to Dr. Weber, the expert, and please.
Okay, well. Hi, Dr. Charlene Weber. I guess I'm the director of the Behavioral Health Department at North Pinellas Children's. These initial slides, I call it the pre-reach and post-reach course and pre-training, post-training numbers. And as you can see that we pretty much all pediatricians have done ADHD for years. And, you know, the amount and complexity has increased over the years. So the volume of patients seen, the number of kids needing to be assessed for that diagnosis has definitely increased over the years. So this speaks to both the need and our ability to fulfill that need. And what we did prior to the REACH course when patients were in need, having suicidal ideation, et cetera, was, well, go to your local hospital, go to St. Joe's, go to Baycare, go to All Children's and get yourself Baker-acted. Because we did not have the skills to treat that in-house. And or we could give them a list of psychiatrists that was 7 months waiting list to get into any of our local psychiatrists, which doesn't serve anybody very well. So the training at REACH has been transformational for our practice, and we are just so grateful to have had the opportunity. I was one of the original 4 that went, and so it's just has changed, I guess, the way we see our own abilities as pediatricians. What Rebecca asked me to speak to is the impact of the program, the growing pains of the program, and the opportunities going forward. So, but I guess I want to start with one of the quotes from our founding father. I don't know if you've heard of Dr. Faber. He was one of the founding fathers of our pediatric group, and find out her child, she knows him too. Basically, what he said is what families need is access to care and a listening ear and a caring heart. They care, what you know too, and that your skills and everything are what they need. But first and foremost, they need access, and that was definitely, lagging. It's gotten better in the community as well. But the impact basically is the quality of life for our patients. I mean, these kids in real time are getting better. The patients are grateful. The number one driving force, this is a mission of service for me, because this has been countless hours of uncompensated time. On top of my 40, 50 hour a week full-time job, I've got another 10 or 20 hour a week part-time job on top of it. So this, myself and Michael Franks, our practice administrator, has spent countless hours integrating this in. It has been hard work. But the reason why we do it is the gratefulness of our patients each and every day, for every mom who smiles when they can hear that, the doctor actually can give advice and they know what they're talking about, and they can give me medication, and they can give me a referral to qualified professionals that can get me in within a week. That's life-changing for them, because parents, they are in crisis. They are facing the expectation of long waiting lists. They are expecting to be Baker Acted. They are expecting the stigma of, what seeking mental health care in the community is like. And their kids don't want to go talk to a therapist. They don't want to go talk to a psychiatrist because of those words. But when they're going to their pediatrician's office, which is a comfortable, expected, like a surrounding that they're comfortable with and know really well, this brings that whole concept of patient-centered medical home, which, is a certification that we all try to get for NCQA and for all that recognition, but we want it to be real, and it is real. And this has brought an added aspect of that realness, because we are truly able to be more patient-centered in the care that we're offering for the kids, because it's, diminishing that stigma. And then from the physician standpoint, it's very gratifying. It's about the most gratifying thing I do. I wish I could do almost all psychiatry now, because, it's cool to fix an ear infection or treat somebody's asthma, or, let them know that their, child is growing and developing normally. But it's really, really, really gratifying when you change the trajectory of someone's life. Like, you take these kids who have not been going to school because of their anxiety and say, okay, first we're going to get you sleeping. Okay, now we're going to get you less depressed. Let's start a medication and therapy. Okay, now we're going to address and see if you are an undiagnosed ADHD who's fallen through the cracks for 5 years, 10 years. So, we are really making meaningful impact. And I think statistics, like those cool graphs, really do show a lot, and data analysis shows a lot, but I measure it in stories. Like, I could just sit here for 45 minutes and tell you stories of the 10 patients that I have taken from, and 10 may be an underestimate or an overestimate, from basically not functioning to going to school and doing well and having normal relationships with family and friends by just some appointments, some, mild SSRI pharmacotherapy, and some appointments with a therapist without engaging a psychiatrist. So I think that speaks for itself. Okay. So the challenges I put down into the 5 T's. Time, treasure, talent, trepidation, and triage, okay? Time is having the time to do all this. These appointments take a long time, It takes 5 or 6 minutes to see an ear infection and 30 or 40 minutes to see a new patient with depression or anxiety. Trying to fit them all into your schedule in a meaningful way that doesn't impact the well child visits and the other sick kids you have to see really is challenging. The time of setting up the program, as I mentioned before, it was a lot of learning all this lexicon stuff, like all the administrative stuff that I had no idea as a pediatrician even existed. Many of those partnerships I had no idea really existed. Oh, what's PAR? What's what's 211? What are all these other things? We had to learn all that from scratch, how to do a budget, how to deal with Amplifund, all sorts of stuff that she held my hand for, okay? So, and then the big other thing I put under time is patient time, and this is still a big challenge, is we have patients that want to come see Gloria, our therapist, and parents have huge challenges, missing school, missing work. I can't get enough time off to give my child the care that they need or take them to these appointments. We have a little trouble scheduling patients between, say, 1 o'clock and 3 o'clock because, so a lot of parents will come in from 8 to 10 because they're on their way to school or work, or they'll come from 1 to 3 because they're finished with school or work and getting out early. But those middle of the day appointments are harder to fill because parents aren't available to take care of their own child's needs. So that's been a challenge in the time issue. Treasure is really bit reimbursement. Again, there's only so many of these behavioral health appointments that a pediatrician can cram onto their schedule and not start to fall behind, because really the compensation and reimbursement on a national and how it all works level, practical level, is that if I see more than about 4 or 5 of those in a day, I'm not going to have enough other patient time to break even. So, they do take more time. So it's a 30-minute appointment is, compensated about maybe 10 to 20% above what a 10-minute appointment would be, or something that I could really do in 6 minutes, like an ear infection. So those are the practicalities of trying to squeeze more, and the need is so great. I mean, I could do this all day long and still not and I could send, we have one therapist, I could have 5 of her and have her full in a matter of a few months. That's the opportunities, right, yeah. So talent has been, we've been so lucky in terms of recruiting. We got the nurse, the care coordinator, and the therapist of our dreams all on the first go-around in early 2020, and retention has been wonderful. It's 100% retention. Then the next stage was when I got past realizing that I can't do this all on my own and got a program administrator. It took over probably 4 to 6 months to have the time to actually find resumes and read them and make phone calls and recruit. So it's a kind of a wonderful joy to introduce Miss Courtney Yallo. She is our new program administrator who is going to help take some of this administrative burden off so that we can do more of the business of pediatrician work. Trepidation, I think trepidation comes from fear. We as physicians are perfectionists. Anything we don't think that we can do perfectly and offer perfect care for our kids. So learning psychiatry and having that question in your head, am I good enough? Do I really know what I'm doing when I start prescribing SSRIs for the very first time? That's what helped that. It was a 6-month after post-reach follow-up course where we would have, like every 2 weeks, conference calls with psychiatrists and other pediatricians across the country who have already done this, to kind of hold our hands and teach us that, yes, we are qualified and we're just as qualified as long as we know our limitations and stick to low to moderate, and then have a appropriate referral pathway for the more highly moderate to severe, that we are just as qualified as a psychiatrist and more available and more trusted by the parents. And the kids feel like this is just a natural extension of their health care rather than some whole new scary thing. And then the last one is triage, in the respect, triage is kind of like, we see our licensed mental health counselor, Ms. Gloria, as a scarce resource because there is only one of her, and quite seriously, I could fill 10 of her. So with the need in our community. So we still have to very much think long and hard, who do we really need to send? Really ones without insurance, really ones that are Medicaid or Simply or Sunshine, or certain insurances that just have such a poor network that we know that they're not going to get in anyway. So we have to ration her, and that's kind of how we've learned to, work through those processes. And then, so finally, opportunities. Obviously, our biggest opportunity is to expand capacity. We have been fortunate enough to recruit 2 more licensed mental health counselors who will be available to start in June. We want to be able to expand our educational offerings to parents. We've done 2 already, and one is scheduled a couple weeks from now, parenting workshops, where we taught, how to parent your child with ADHD, how to parent your child with anxiety. Now we're going to do more of a generalized parenting one. And we did them in person. We've, created from scratch the educational content and everything. And once we've, rolled these out in person with, the 30 or 40 people that will fit in our lobby to have this program, we're going to start to try to, with our new staff, be able to offer it monthly on a Zoom, like a live and Zoom. Like some people, the 30 or 40 in our lobby, plus another 100 on Zoom. So we'll be able to, really greatly expand our outreach once we've worked through the initial start startup of all of this, creating the programs and then launch them and make them more frequent. So that's another opportunity. Opportunity to share what we've learned with other physicians in the community, to medical meetings, sharing it with our own other campuses. We are North Pinellas Children's Medical Center. We have 9 pediatricians in our Pinellas location, but we have a sum of 11 between our 2 Pasco locations, another 11 between 2 Pasco and Trinity. So we're letting the information roll downhill. We've got trickle down all this information to our other providers and nurses and staff members. And then we just are actually looking to explore new services on our own. Might we want to hire a developmental pediatrician? Might we be able to get a psychologist to help us unwind the backlog of autism evaluations that no one's able to get, or a family nurse practitioner? So that's kind of what I had to share today. Thank you.
Thank you, Dr. Weber. So now I am going to ask for the board's approval to increase North Pinellas Children's Medical Center's allocation.
Do I have? Ms. Rutland needs to leave. We can sort of immediately go. Yes, can we go
I
immediately
motion to
to the vote?
approve.
Do I second? All in favor? Aye. Any opposed? Thank you, Ms. Rutland.
Thank you. Thank you.
There might be some questions.
No, we can have questions. Were there any questions and/or comments? I'm sorry we had to do the vote first. But are there any questions and/or comments? It was a wonderful presentation, and this is near and dear to my heart because I do see mental health all day, every day. And so it is wonderful to be able to ask the families, have they spoken with their pediatrician at least?
I wanted to ask that there was a chart that showed the increase in diagnoses for anxiety and depression, and you talked about, both of you talked about it as pre-reach and post-reach, and I wonder too where in that timeline the universal screenings took place, and whether how much of that your sense is would be not just your capability to treat them and to diagnose and treat, but also just undetected because the families without the screening wouldn't report anything. So they're undetected for years. I didn't ask that question very well, but.
Yeah, the screenings, basically, we've been screening with PHQ-9s for adolescents long before the REACH program. So that screening has been in place. I think the increase in anxiety and depression diagnosis codes is that we're handling, yes, there is a higher level of it in the community with each passing year, the number of teens and preteens. I mean, I've got 5 or 6 that I'm treating now that are between 9 and 11 for significant anxiety. That level is increasing, and it's a reflection of the increased prevalence in the community over time, which can be seen nationally as well as locally. Some of it is, again, I think what we're trying to, with our enhanced screening is what we started new after REACH, and with the JWB thing was the PSC 17s, which are for the children 4 to 11. That's new as of, March or April 2020, yeah, right when COVID hit.
Yes, so that little star, the 1920, was when the REACH Institute, the in-person thank you, the in-person training, and then into 2020, 2021 was case consultation calls. So really that time was when they were building their skill set, becoming more comfortable, and also rolling out more of the PSC 17 screenings more broadly within their practice.
The other thing I wanted to ask or have you address was, when you think about a training, some of us may think, 3 hour training. Tell us about the breadth and the time commitment it was for the pediatricians to do the REACH training.
Oh, that was a 3-day training. It was about an 8-hour course, 3 days. And then they had the case follow-up calls for about an hour and a half every other week for 6 months. But it was a very comprehensive conference, which is what you need. Nobody is going to, in their right mind, take up a new skill set with a 1-day conference or a few hours of education. It really, you do need to feel that sense that you've got somebody, if you have a case that you don't know what to do with, that you have, backup. And actually, it has also been very helpful that Johns Hopkins All Children's has psychiatry hotline where private practice pediatricians can call up and say, if I have a concern, this is happening, I don't like the way this is happening for this particular patient, can you give me some advice? And I don't think any pediatrician in the community would be comfortable doing this if that second-level resource wasn't available. Because we want to do no harm, we want to be comfortable with what we're doing and have a backup plan for those in whom we start to lose that comfort level.
And I know you all referenced the first implementation or wave of implementation of this with Evera Health, but I just want to recognize Joe Santini and Evera
Thank you,
Health,
Joe.
who in so many ways have been just ideal community partners. You know, I can't say enough about not only what they've done within their own practices, but their willingness, ability, and competence at providing community trainings of all sorts, you know, far outside of the scope of their own practice. We're lucky to have them.
Yes, we learned much from you, Joe, thank you.
Well, and then the other thing I would just add is the data, their systems analyst. We just met the other day to talk about this year's data, and you know, she has gone down or up to North Pinellas to work with their practice to figure out how we can pull the data, because their systems aren't the same, but also Evera Health is set up for integration of care, whereas that's what we're working to do with North Pinellas, because there are additional codes, and I don't want to get too much in the weeds, but there are additional codes that are needed and requirements in order to be able to bill for behavioral health services. So we have tapped Sunshine Health. We got connected with them, but it is a process. We're slowly making our way there. That's why the addition that you have approved, thank you very much, by the way, will also support a billing specialist.
I just wanted to say that looking at that past slide and looking at the numbers, I'm appreciating the fact that you're now addressing anxiety and depression, as I'm sure the superintendent deals with that daily within the school systems and across the board. And it's the community has begun to identify these real issues about their children in this space, and for whatever the reasons are. So 901% increase, although I know it's small, into somewhat small numbers, is still alarming. And the fact that you're able to begin to address that is I'm surely really appreciated by all. It's just mind-boggling to me to realize that we're now in the state of continuing to move in this direction, and fearful that, you know, that it's not going to get any better. So again, thank you all for your hard work and focus on this area, and hopefully we can stem the tide in the near future.
So my question was a technical one. You did talk about a little bit about the insurance and the billing issue. That's hyper-technical, of course. But are these behavioral services going to also be covered under Sunshine? You alluded to it a little bit. Sunshine, Medicaid, you know, those broader insurance plans?
So that's the intent, and
Okay.
You know, when we created the design teams, the finance is one of the pillars.
Yes.
We have some other, Florida Blue, for example,
Right.
and others, but they said, you do the work, get the data, bring us the data, and then, you know, we'll have a conversation. And so that's really what we have to do to bring them more data so that we can.
Right.
Joe, do you want to speak? You probably know better than I do, but it's just, it's a process, and it requires time. But when you looked at the first slide, when we talked about the integration, $150 per
Right.
child right now, and I mean, and then it goes deeper, but it's like, if that's not a return on your investment, I don't really know what is. So if we could get the managed care companies to see the work that's being done, to see the prevention and early intervention and the cost savings to the community, I think I mean, it makes sense.
Yeah, I think that component is incredibly important. I know
Yeah.
both personally and professionally, I think one of the biggest barriers to accessing behavioral health is that payment portion of it, is the insurance portion of it. We can't get the kids that really desperately need those services if there's no way to pay for it. So I think that is a huge component, and it's incredibly important. My second question was, I guess for Dr. In terms of your practice, what is the scope of the qualifications of people who are serving? Are we just talking about pediatricians who are also trained? Are we talking about psychiatrists, licensed mental health counselors, other qualified therapists, OT? Like, what are we talking about here?
We're basically all private general pediatricians' offices are pediatricians, and some have physician extenders like nurse practitioners. We do not. We're all pediatricians. And then we have one licensed mental health counselor providing some of the counseling and a lot of the emergency intervention. Like when we have kid after kid, I mean, it happens almost every day that we have a teenage physical who, oh, by the way, scored highly on their PHQ-9, oh, by the way, endorsed suicidal ideation. Let's go have an intervention where we'll send in our therapist to try to make sure that this is not an acute suicidality, but rather more of a passive suicidal thoughts, and then work towards getting them into care. So, but for now, we are all pediatricians who had residency training on some mental health. ADHD was well-trained back when I did it 20-some years ago. It's now much more comprehensively taught to the younger residents and the younger physicians within the group. They're getting that as part of their training in medical residency. But the REACH course and REACH training is what we learned. We get other programs. American Academy of Pediatrics has tons and tons of CME resources that we use as well, continuing medical education. So REACH was not our only source. We can access whatever. There are many, many workshops that help to, because this is not just a local problem, nationwide, the number of kids with need far exceeds the need. And pediatricians are being asked to take on more and more of this role, and there are resources to help train us to be equipped to do so.
And I think that REACH training is also just so critical to being able to reach more, more children, because I know recently I had a conversation with the medical director over at the Rothman neuropsychiatry department, and he was talking about how pediatric psychiatrists are one of the rarest breed, and he mentioned something like there's only about like 34,000 pediatric psychiatry specialists nationwide, and 9,000 or something, and he's like, we need probably like 34 or 50,000 of them to be able to provide the services that the population needs. So I think being able to train, our everyday pediatricians is just such a great way of accessing
We need much greater numbers so that we can save the most complex, the ones who are generally got, schizophrenia, bipolar, the more severe cases, for the psychiatrists that do exist. Yeah.
Yes. Thank you so much for the work you do.
Thank you.
Thank you.
I was just going to add that in response to Ms. Nage's question, while we expect, and it's part of our contract with any of the providers that have some other third-party reimbursement mechanism, Medicaid or insurance, any of our behavioral health providers, that for clinical services, billable services, that they do bill those third-party payers, and that they then invest those funds within the program. I think, one thing it gets in the weeds real fast, and I won't go there, but is that, and Dr. Weber talked about a specific example, a 30-minute visit with a pediatrician. That's what you have to do if you're dealing with a mental health issue, is not paid at the same kind of rate for the time that a quick visit, child visit, or an ear infection or whatever would be. And so if you're a private pediatrician, you're disincentivized to do that. It's a real labor of love on the part of a private practice to choose to do that. We've tried to provide payment and support for the behavioral health specialists and so on, even though it is our hope, and they're continuing to work on, can we bill better? Can we be more effective at billing and so on? But I would just say, the best billing operation in the world is given a variety of shortfalls within Medicaid, both in terms of things they do or don't pay for at all, or limitations on how many visits, which is particularly true within Medicaid managed care, which is Sunshine that she referenced, or services that just flat out aren't covered, like, I think I understand, maybe not the diagnosis, but the qualification for behavioral therapy for autistic kids. They'll pay for that particular behavioral health intervention, but they won't pay for the assessment it takes in order to do that. So there are a lot of gaps in Medicaid billing, let me just say, as well as private insurance. Most kids are now covered by something. If they don't have commercial insurance or HMOs, a significant number of kids do qualify or eligible for Medicaid. And if not, kid care is available to them. But the payment levels from those are just, abysmal. So one of the things JWB is going to attempt to do, and we'll see, I don't mean to promise anything here, but Paul Webb and I, who works for Becky, are going to work to find a good Medicaid consultant or somebody who really understands this payment methodology to inform us better, so that primarily we can be better advocates, probably across, this is not a Pinellas County issue, this is a state of Florida issue, that we can be better advocates along with other interested parties across the state. Because a lot of the funds that JWB is paying for behavioral health, which is incredibly important and impactful and a real priority for this board, we're having to do because Medicaid so grossly underpays for those services. Yes? It's easier for somebody third party to say that than the people who are or are not getting reimbursed well. So, but it becomes a community issue, it becomes an access issue.
We went through a credentialing process that our credentialing people understand and know because they do it for medical professionals. But the doing it for a therapist is the rate limiting step in trying to credential our therapists and allow them to get paid for the work that they do instead of having to depend on JWB funding. So that's the next goal, now having some additional support, and again, the support that Paul Webb is giving us to be able to help us do that.
Good morning, Joe Santini with Evra Health. The thing that I'd like to just add to Beth's comment is there is not parity in payment for behavioral health services and medical services. That is the issue. The other thing that you may not be aware of is there's 2 Medicaid handbooks. There's one for private practices, and then there's one for FQHCs, which Evra Health is a federally qualified health center. And in our handbook, we can't get reimbursed for licensed mental health therapists. We can only get reimbursed for licensed clinical social workers. That is the only type of therapist we can get reimbursed for. So there's nuances between the 2 books, and there's no parity. So any help we can get in advocating for parity and advocating for equitable reimbursement for same services by differently licensed people just makes sense and provides greater access, and then to Beth's point, can then be reinvested back in our organizations, and this would impact all behavioral health organizations to serve more people.
Thank you for all of those comments. And we are seeing it every day in the dependency world, trying to find providers that will take our kids with the type of insurance that they have. So this is a fight for everyone, not just for the professionals. Next, we'll have the presentation of the 10th Annual Children's Summit and FY23 Annual Video Report, and that will be done by Ms. Linda Leedy.
Good morning again. I just want to thank you for your approval of that last action item, because this effort is also very near and dear to my heart. Thank you, Dr. Weber, for being here. Okay, on March 7th, JWB hosted our 10th annual Children's Summit with roughly 200 community leaders, elected officials, county and city staff, JWB-funded CEOs, and other community leaders. This year's theme was The Power of Connections, featuring a thought-provoking morning with two experts in the field of children's mental health, with a special focus on the impact of social media and screen time on youth well-being. We kicked off the morning with a powerful message from venue host, St. Petersburg College President, Dr. Tanja Williams, followed by a warm welcome from JWB Board Chair, the Honorable Patrice Moore. And then our CEO, Beth Houghton, gave opening remarks, unveiled JWB's fiscal year 23 annual report video, and informed guests that the topic of social media and screen time usage was also of keen interest to the Pinellas County Health and Human Services Leadership Board. And then Beth introduced our two featured speakers. First, Dr. Jennifer Katzenstein delivered a compelling and data-filled presentation titled Social Media and Mental Health, Understanding the Impact for Youth. Dr. Katzenstein is co-director of the Center for Behavioral Health, director of psychology, neuropsychology, and social work at Johns Hopkins All Children's Hospital, and associate professor of clinical psychiatry and behavioral services at Johns Hopkins School of Medicine. She has presented to this board before, most recently with Becky at last year's Children's Mental Health Initiative update. Next, we had Dr. Whitney Ragland-Bignall present on the importance of belonging for kids and tools for social media. She stressed that we are all social creatures and that children who feel connected to families, schools, and neighborhoods develop a sense of belonging, which is associated with positive physical and mental health. Dr. Ragland-Bignall is an associate clinical director for the On Our Sleeves movement for children's mental health, affiliated with the Nationwide Children's Hospital in Columbus, Ohio. We did receive glowing feedback from this summit. Multiple leaders in attendance shared that this was one of their favorites. I happened to talk to Dr. Cho right afterwards, and he shared that he'd had an aha moment when the speaker was referring to the U.S. Surgeon General's report on loneliness. And he was like, root cause, okay. We communicated since then, and he and I are going to form a journal club so we can continue to read all this good stuff. And finally, a special thanks to JWB board members in attendance and to our speakers, guests, and staff who made this year's summit an enlightening event and huge success. So at this time, we will dim the lights and share our fiscal year 23 annual report video.
While we're doing that, I'll give you a little information on the Health and Human Services Leadership Board. And there's a tie-in to the presentations that were made on the annual report. Got it? No? The Health and Human Services Leadership Board is made up of 3 county commissioners, 3 members from this board, and 3 members from the Pinellas County School Board, as well as Sheriff Galtieri or his designee. In the past, that group has, and the purpose of that group getting together was to enable all 3 of those significant players in the county to coordinate efforts on issues where a concerted or a coordinated approach would be helpful and within the human services world. So in the past, those topics and efforts have included homelessness with a shift in approach some years ago that all 3 organizations took, 2 of them in their funding of outside programs, but also the school system with regard to the significant number of homeless students that they see and serve. Then it was at a Health and Human Services Leadership Board that the issue of the crisis in mental health was raised up and discussed at length, and what came out of that was sort of a divide and conquer approach with the county taking on adult services and looking at what they could do to sort of unclog the system, as it were. And because access was the biggest issue that was brought up across the board, whether it's pediatric or adult. And one of the initiatives that the county led was this identification of frequent users of community resources because of persistent and chronic mental health issues. So they identified 30 individuals who were constantly Baker-acted at our hospitals, or constantly arrested and in jail, and in a variety of ways we're using huge resources, but not really receiving the kind of longitudinal care that would make the most sense. And so the county took that on and provided and put money behind that, primarily with PIMS, I think, to really super case manage and wrap around those 30 individuals to try to get better results, but also to prevent all of the really unhelpful.
It's part of our fabric.
Okay. And the Children's Mental Health Initiative was the JWB's piece, along with the school system, to pick up and work in the ways you've heard relative to access to care and a better system of care for children. Yeah, go.
The Juvenile Welfare Board has always had a taste for innovation. It's part of our fabric and written into our mission to invest in innovative ways to strengthen children's lives. But we don't do this alone. We form partnerships that generate new ideas, expand the brain trust, and maximize resources. And we invest in these partnerships, leading the way to better futures for kids. As we reflect on JWB's work and impact last year, one word comes to mind: connections. Early connections to make the most of baby's first 1,000 days. Healthy human connections so youth feel a sense of belonging and hope. Strategic connections with investments in new, innovative programs to address unmet needs. And creative connections, where the promise and impact of our best practices are reaching beyond the walls of JWB for the good of all children.
Last year, JWB allocated $95 million to strengthen the lives of children and families in Pinellas County. This included roughly $5 million for new, innovative programs, plus another $5 for workforce stabilization, all of which contributed to a record $17.1 million in new investments for kids last fiscal year. As a result, 70,000 children and families were served by 100 quality programs provided by 53 nonprofits. Plus, tens of thousands more benefited from JWB's campaigns, initiatives, and collective impact. For example, 7,000 parents received life-saving education and baby bags geared towards infant-safe sleep. 3,000 kids participated in free swim and water safety lessons. 17,000 books were given away to help early readers become future leaders. And 700,000 free meals went to kids to fight childhood hunger. Plus another 5 million plus meals thanks to JWB's bulk food investments. JWB also engaged a consultant to better inform our fatherhood collaboration in its role supporting and giving dads a voice, and increased annual funding to our Family Services Resource Pool to strengthen and support those caring for children. We warmly welcome 2 new members to our JWB board, Kristen Nage and Melissa Rutland. And our 3 community councils hosted family-centered events, released new community support funds, and informed JWB's work by serving on procurement review teams. JWB-sponsored trainings and events benefited thousands. From our annual Children's Summit, where leaders convened to imagine the future for kids, a conference focused on self-care for out-of-school time provider staff, and JWB's annual awards luncheon, where boots on the ground Kids First winners were celebrated. Promising youth received educational scholarships, and our second ever Dillinger McCabe Leadership Awardee was named in a surprise announcement to close the event. We onboarded a total of 14 new staff last year, bringing a wide range of expertise to JWB, made improvements to internal procurement processes, adopted new data systems for increased efficiencies, laid groundwork for a new stockroom, position, and van to support JWB's outreach efforts, and held our annual team building event, where JWB staff were celebrated for crushing it all year. The first 3 years of a baby's life are critical to shaping their brains and their futures. Last year, JWB launched Turbo Babies, an early childhood public awareness campaign that reached more than 8,000 parents and caregivers with supercharged messaging and materials. We also funded 5 new early childhood development programs, invested in a support position for those seeking early childhood education degrees, and planned events to support grandparents raising their grandchildren.
Early connections matter. Learning begins at birth, so does a child's mental health. From day one, babies begin to understand a world of loving, attentive, and dependable adults, or not. In these formative years, a baby's brain chemistry is impacted for life.
You know, when I had a chance to talk to the JWB board about the importance of the early years, that they were moved not only by the scientific information that 80% of the baby's brain develops in the first 3 years, but by the fact that the brain development is shaped by the everyday experiences that baby is having in her house, in her neighborhood, in her community, with her family. And I knew that because of what you all taught me, the case that was really made to JWB about the importance of those early months and years of the baby's life.
JWB continues the important work of promoting children's mental health and wellness by reducing stigma and fostering healthy connections. We're increasing access by integrating behavioral health and support services within pediatric practices. Last year, nearly 15,000 children were screened by pediatric providers for early detection and intervention, and more than 6,000 behavioral health visits occurred within those settings.
JWB's Children's Mental Health Initiative is continuing to increase capacity among our local pediatricians. We're getting them better equipped at identifying, diagnosing, and treating the lower to moderate mental health conditions while making behavioral health and other support services available within the child's medical home. We're focusing on public awareness and family engagement. We're hoping to normalize conversations around mental health. Our goal has been and continues to be getting further upstream, focusing on prevention and early intervention.
The best thing about the program really has been the feedback from the parents. They are so grateful to be able to have their children's mental health needs met here, and also they don't have so much fear. There's not so much stigma about going to, say, a psychiatrist as opposed to having your needs met by your pediatrician.
Last year, JWB awarded $6.5 million for new programs that align with one of JWB's 5 strategic goals. And the majority are focused on early childhood development and the prevention of abuse and neglect.
JWB's 12 new programs have really gone the extra mile towards innovation. They're searching out and filling unmet needs and gaps, and really getting to how we can change the trajectory of a child's future.
Without a doubt, our new programs are strategic. They're designed to reach and engage some of our most vulnerable families, for the families who may not be ready to seek support today, but could be tomorrow. They are increasing our footprint in early childhood, building capacity for high-quality early learning, and offering behavioral health interventions to prevent abuse and neglect.
When the YMCA of the Suncoast revised its strategic plan in 2017, we added a very important component, which was how we can help prevent child sexual abuse. We are so proud of our partnership with JWB, where we're able to educate both children and parents on what grooming behavior look like that will help prevent child sexual abuse.
JWB continues to gain momentum as an innovative thought leader for kids. Taking a community approach, we shared our mapping capabilities to measure child opportunity at the neighborhood level. We were invited to roundtable discussions at the White House to help ensure accurate mental health storylines in TV and films. Our Sleep Baby Safely campaign was replicated statewide. 19 counties now share its consistent message and materials to protect babies from sleep-related suffocation every night and nap. JWB staff were also recognized and celebrated across the region and state for their stellar work and contributions for kids.
Given our broad range of expertise on key children's issues, we are frequently invited to the table to have a leadership role. We have a community mindset. If it's about kids, JWB is there.
We're moving forward with great intentionality, making not only creative connections, but also courageous ones. So when our influence, expertise, and ideas take hold in other places, it's value added for all children.
From the earliest of days, we come into this world craving the presence of others, longing for human connections. For more than 75 years, JWB has been uniquely positioned as a leader, a convener, and a dot connector for kids. Our goal is that children in Pinellas County are ready to learn, thrive, and succeed in schools, homes, and neighborhoods that are healthy and safe. It's rooted in our guiding values that we embrace collaboration, pursue innovation, and value every child. That's the power of connections.
Oh, okay. Pleased to give my report on the last month's activities. First, JWB was designated a best place to work. Pleased to share that we are one of 60 local companies named a best place to work by the Tampa Bay Business Journal. Scoring for the best place to work designations based on confidential employee surveys. So it's quantitative and objective as opposed to more subjective responses. A third-party company called Quantum Workplace surveyed our employees about company culture, including compensation, benefits, and trust in leaders. Quantum's analytical tools selected the top organizations in each size class, small, medium, large, and extra large. JWB, for starters, had a more than 90% response rate, which is in and of itself extraordinary. We worked really hard at it, but the employees ultimately had to choose to respond. And as a result of that data that was collected, we were named a best place to work in the large category, which is 50 to 99 employees. The final rankings will be revealed at the Best Places to Work event on May 2nd at Raymond James Stadium, kind of a multi-company picnic. And that will be hosted by the Tampa Bay Business Journal, so we'll see. As you may remember, I shared this with you before, and our primary focus on wanting to do this survey was to receive the results and to help us know what we were doing well, what we had opportunities to do better. And we certainly are taking all of that into account. I will say that by and large, not only were the results the quantitative results very high, but the comments generally were really extraordinary. You have a lot of folks at JWB who are passionate about working here, and they are passionate about working together with each other. I'd like to acknowledge our community engagement team, JWB's community councils, and many other JWB staff who have been working really hard to plan 3 Grand Families events. I see Yaritas over there smiling proudly, as she should, and so many others. That these 3 events are taking place this spring. One of them already occurred. It was sponsored by the North County Community Council, was held on March 14th in Dunedin, and attracted more than 100 families. They enjoyed a sit-down catered lunch, speakers, music, magic show, resources, giveaways, and more. So it was alluring and engaging because it was fun. It was clearly family-oriented, but with other caregivers and grandparents that were in a similar role, but there were also some amazing and very, very helpful resources for these grandparents and other family members who are raising kids, often because their peers are not in the child-raising mode, and they did it 20 years ago or whatever. They're not aware of how to work with the school system and how to access data and sign up their kids for this, that, and the other that is probably digital now, not paper-based, which might have been what they were used to. So there are a variety of ways in which it is more challenging for grandparents and other family members to work through all the systems of resources as they raise their grandkids. The free events were open to the public, and as well the other 2. And they are family-friendly and fun. North County, which is the one I just talked about, and then soon to be Mid and South County. We also had a report, ABC Action News filmed portions of the event, and they plan to go to the other events, and then there will be a story on those events after that. And Yarides Garcia was interviewed by guest host Maggie Rodriguez for a segment on WFLA's Bloom TV that aired on daytime television on March 18th. So our next two dates are April 6th from 10 a.m. to noon at Lake Vista Park in St. Pete. And that's sponsored by both our South County Community Council as well as St. Petersburg's Park and Recreation. And then Saturday, May 4th from 10 a.m. to 2 p.m. at the Pinellas Park Performing Arts Center as sponsored by the Mid-County Community Council. Lots of work go into these things, lots of moving parts, and so I appreciate everybody who's done this, and I'm sure we've learned more and we'll see what we do next. Let's see, yesterday, sort of a personal note, but my husband Scott Wagman and I cut the ribbon on a new exhibit for little ones at the Great Exploration Children's Museum that we're personally sponsoring. It's called Little Explorers Lagoon, and you may know that we've been engaged with the museum for 30 plus years in supporting it. Well, since we were sponsoring the space, and because it made sense, I sort of nudged the museum staff to find a way to incorporate the messages of turbo babies within that space. So, so inside the exhibit, we have a TV monitor that plays on a loop a brand new Turbo Babies video that we'll, I'm sure, be sharing with you soon. That shows local parents and grandparents playing, connecting, and engaging with their babies. With our own Alicia Henson, who leads our Turbo Babies effort, was with the narrator and sort of MC, the star power, really, you know, behind the or on stage, so to speak, up front for that video. And there are also takeaway materials there for parents. And for any of you who have hung out in any children's museum with littles, you know that as a parent, you're sort of sitting in the corner, the kids are doing what they do, they come back and check in with you, but you're there, you're a captive audience. So that was the thought behind this, is that it's a way of getting these messages to parents and grandparents at a time and place that they're already there and they're already thinking about their little one. Now, outside of that, within that 0 to 3 space or in the entryway, there was an opportunity for JWB to sponsor, I'll say, signage and interactive exhibit for Turbo Babies, and that is physically there, but will be unveiled at a future time, and we'll get lots of press and coverage about that. It's a racetrack that is wooden with various and sundry turbo cars that can be placed on that racetrack. They are magnetic, but they only are magnetic to either the parking lot space or actually on the racetrack, so kids and adults can play with that and have the Turbo Babies name and some other language in front of them. Thank you all for being part of our honorary host committee again this year for our annual Kids First Award Luncheon. It will be April 26th at the St. Pete Coliseum, and we hope that you'll be able to join us, host a table, and help us celebrate our 3 main award programs that we unveil at that event. The Dillinger McCabe Putting Children First Leadership Award, which of course will have extra special meaning to us all this year. The Kids First Cooperman Bogue Awards, and the H. Browning Spence Education Awards. We had a moment of silence earlier in this meeting for the passing of our friend and colleague Bob Dillinger, and our hearts are heavy from the loss of our dear friend, a child advocate extraordinaire, and a JWB Legacy Board member, the Honorable Bob Dillinger. Earlier this week, I shared his obituary with you, which included information about the tribute planned for this Saturday, March 23rd, from 1 to 3 p.m. at the Pinellas Park Performing Arts Center. I'm honored that Kay has invited me to speak briefly. She wants everybody to speak briefly. On behalf of JWB, and to share Bob's commitment to the marginalized and the voiceless, particularly children. In Kay's words, she wanted us to remember Bob's work with Bernie at the JWB for underprivileged kids. Bob was truly one of a kind. He was an inspiration to those who knew and worked with him. He was a passionate and effective advocate for children, those who were homeless, and people struggling with mental health issues. You pretty much knew if caller ID came up and it was Bob Dillinger, he was going to convince you to do something, to join him in helping kids or the underserved. He made it his life's work to fight childhood hunger and to meet other basic needs of children and families to prevent deeper end services. And he saw those kids who were in the deeper end every day. His dedication to the children of our county is just unmatched. Even in his final days, it was all about children and the next generation of leaders for kids. When the Dillinger-McCabe Leadership Award Selection Committee met a day after his passing, Bob and Kay had already seen to it that his rankings were among those that were available for consideration. He and Kay, in his last week, reviewed the nominations, and Kay emailed them to us before that Monday meeting because she knew how important it would be to him. That was Bob Dillinger, putting children first. As a reminder, well, up here you see Bernie, and many of you sort of know the story of Bob joining this board and Bernie joining this board, told slightly differently if you listen to Bernie or you listen to Bob. But Bob, as a child advocate and knowing how much was going on at the Juvenile Welfare Board for kids, wanted to have a voice at this table. And he approached then Senator Jack Latvala to make that part of our special act so that the public defender would be an ex officio member of this board through time. And Jack said, well, okay, but I'll only do it if the state attorney, Bernie McCabe, is also there. And that wasn't necessarily where Bernie was in his work at that point in time. And through some combination of Jack and probably by Bob, Bernie said yes. And in Bernie's own words, he talked about the deep friendship the two of them had, the shared vision both of them had, and how much it had, even though he sort of came kicking and screaming at first, how much service on this board had meant to him, to Bernie. So both of them were really lions at this board table, always assuring that that other board members, that management, that staff, that our agencies were accountable to do the best for children. And that was their single sort of point of reference is it the right thing to do for kids? And if it was, they were all there. As a reminder, the family is requesting that in lieu of flowers, donations be made to the Beth Dillinger Foundation. The foundation is named after the Dillinger's daughter, Beth, who died of suicide. Among other things, the foundation supports Nourish to Flourish, which provides over 1,000 packs of each Friday of weekend food for hungry kids in Pinellas County, and has done so for years. Thank you for your continued support of JWB and its mission, and some of you may want to comment on Bob as well.
I'm glad you brought up the fact that we received, prior to our review, Bob's input, which just said how dedicated that he really was and how important this award has been to him and to Bernie. The picture says it all. Now they're walking together.
I sit here today because of Mr. Dillinger. He hired me right after he got elected, and I actually started right before he did. And I can remember him speaking at my investiture saying that I went from working for him, now he was working for me in my campaign. and so he will be greatly missed. If nothing else, we will go to the information items. Any questions, comments, concerns on the informational items? Hearing nothing, do we have any public comments? No, now we will go to our milestones and we'll go back to Beth.
Our February anniversaries are Jomar Lopez, 4 years, and Janine Evoli, 32 years.
Do I have a motion for adjournment?
So move.
All in favor? No objections.